Hello, my name is Caleb Gish, and this is a PowerPoint presentation on dealing with disruptive staff problems and workplace violence. So as an introduction to workplace violence, there's a definition from the book. Workplace violence is any violent act, including physical assault and threats of assault, directed towards a person at work or on duty. This includes threatening actions, verbal threats, physical attacks, and violent assaults. In healthcare, there's a lot of vulnerability to workplace violence. I doubt many of us have gone throughout our career without at least being verbally threatened or verbally abused by a patient or maybe even a coworker. So objectives for this PowerPoint are to identify harassing behaviors such as bullying, lack of civility, and horizontal violence, as well as identifying techniques for handling problematic staff issues and techniques for handling substance-impaired employees. There are three harassers that we will look at in this PowerPoint: bullying, lack of civility, and horizontal violence. Some examples of bullying are ignoring coworkers or the silent treatment, belittling behaviors, ridiculing, verbal abuse, gossiping, sexual harassment, disparaging remarks, and isolating individuals. The consequences of bullying are high call-offs and high turnover of nursing, which is turnover of nursing is very expensive for facilities, so it's important that we don't tolerate bullying. Bullying can occur online, in person, or by text message. The Joint Commission recommends a zero tolerance for bullying. According to this article that I found, 35% of Americans experience workplace bullying, which is very high when you think about it. Here we talk about lack of civility and horizontal violence. Some examples of lack of civility is rudeness, disrespectful behavior, impoliteness, ill-mannered, yelling, swearing, and spreading rumors. Horizontal violence is defined as violence or harassment between coworkers. Again, there should be zero tolerance of this. Here I found an article that talks about nurses eating their young, which is a phrase that I've heard before, where nurses don't mentor new nurses as well as what they should. New nurses sometimes feel scared to ask questions, and this leads to poor patient care and could lead to even a patient being harmed. So it's important that nurses who are training newer nurses are open to questions and avoid horizontal violence towards them. Some factors that contribute to workplace violence include long wait times, overcrowded waiting rooms, lack of security, unlimited public access, and poorly lit hallways. And unfortunately, oftentimes workplace violence against nurses is underreported, and some contributing factors include nurses may believe it is part of their job, belief that it may reflect poorly on the nurse, or poor definition of what workplace violence is in many institutions. There should be a zero tolerance policy for any kind of workplace violence. The institution should have clear policies regarding workplace violence for employees, patients, and visitors. There should be immediate removal of individuals who become aggressive or violent. And there should be a code of conduct for both for patients and family members. I know in the emergency department that I worked, sometimes this is a little bit of difficult subject because we sometimes have violent 302s who have to be there, and we can't remove them. So early intervention for these people is very important. The use of seclusion when necessary and medical sedation when necessary as well. So nurses should be educated about reporting these type of issues. They should be educated on warning signs of violence. Conflict resolution is very important, and education on who and how to report violence. I think conflict resolution is very important, and as well as identifying behaviors of aggravation or agitation, such as when a patient starts pacing, or looking at nonverbal cues from patients as to escalating agitation, so that there can be early intervention there. So this slide continues with preventing workplace violence. There are environmental controls to preventing workplace violence, such as adequate lighting, security devices, bullet-resistant barriers in the emergency department, curved mirrors in the hallway, adequate staffing, restraints or seclusion when necessary, staff notification of patients with history of violent behaviors. I know working in the emergency department, nurses need to be vigilant of possible violent both patients and visitors. We've had numerous incidences of violence in the past, or patients coming in with knives or pieces of glass that could be used to hurt nurses or other patients in the department. So here is this article again that talks about eating their nurses young, about nurses eating their young, and they're recommending education to graduating nurses about horizontal violence. They recommend lectures and role play as teaching methods for teaching new nurses about horizontal violence. Here we're going to talk about handling problematic behaviors in nurses. So here we talk about marginal nurses who are low-level nurses despite coaching and discipline. And these are not just new nurses straight out of nursing school. These are experienced nurses who don't work up to their full potential. Some examples is poor communication skills, or poor decision making, or unmotivated individuals. Managers should follow protocol for dismissal if no improvement after coaching these individuals, which is usually a verbal warning, a written warning, and then possible termination. Managers, part of managing is handling disgruntled employees. Here are some tips for addressing employee complaints. There should be a set of standards for performance. The manager should write down information regarding the incident or the complaint. There should be early intervention and fairness between staff, and there should be follow-up with the employee. I know there's been times when I've had complaints and I've taken it to my managers, and sometimes they say that they'll follow up and never do, and I always appreciate when they do follow up. So here we're going to move on to substance abuse problems in nursing. This is an increasing issue. According to the authors of this article that I found, 10 to 15% of healthcare workers experience substance abuse issues at some point during their career, which is pretty high number. Early recognition and intervention of alcohol and drug abuse is recommended in the book. So here are, this slide talks about alcohol use and symptoms. So some signs of alcohol use when identifying an employee who is intoxicated. They may have odor on their breath, difficulty focusing, and you can read through some of the other ones like absenteeism, irritability, and then there are some withdrawal symptoms that you can read through. So here we talk about strategies for intervention and re-entry. When an employee is recognized to be intoxicated with either drug or alcohol, they should be immediately removed from patient care, and the organization's policies and procedures should be followed. Notification of the nursing supervisor or the charge nurse is important there as well. There should be documentation of the individual's behaviors, job performance, records of controlled substances, and physical signs and symptoms. They should be offered drug or alcohol evaluation or rehab. If this is refused, then the State Board of Nursing should be notified according to the book. Re-entry should be carefully planned. There should be a possible restriction phase where the individual has decreased access to controlled substances, limited overtime, and possible relocation to a different unit. Some areas that the book identifies that nurses may not work in after a situation like this would be like maybe the emergency department or intensive care, where there's a high use of controlled substances. Some areas that they did suggest were like working in a nursery or doing paperwork or teaching even. So I have here a video about nurses stealing prescription drugs from institutions and from patients. I'm not able to get it to play so that it runs with the PowerPoint, but I do have a link here that you guys can watch it afterwards. These are the references for my presentation. Thank you so much for listening, and I hope you learned something.